I would like to introduce Dr. Regina LaRocque, who is an infectious disease specialist at the Massachusetts General Hospital and an associate professor of medicine at Harvard Medical School. Dr. LaRocque is going to present on COVID-19 and tell us her experiences in Massachusetts. As you know, the United States is currently suffering a severe surge of this disease, and there are even more dangerous threats existing abroad. The South African and Brazilian strains of this virus are very problematic. These strains are felt to be able to evade monoclonal antibody therapies and may also cause false negatives on testing. The vaccines may also have reduced effectiveness against these strains. Vaccine resistance might also be a possibility. On that grim note, Dr. LaRocque will bring us up to date on what is happening in Massachusetts and that region of the country. Dr. LaRocque, I will turn the microphone over to you.
Well, thank you very much. I really appreciate the opportunity to be with all of you, some of whom I can see and some of whom I can't. But um, I will just say that I consider Chris Pontus to be a dear friend of mine at this point, even though we have not even physically met, I think, Chris, right? um, I have a cohort of pandemic friends I have made over the last year, and I rank Chris high among them. I think we have a shared interest in workplace safety, and I've learned a lot from you, Chris, and it was through Chris that I'm invited to talk with your group tonight. And I hope you don't mind that I haven't really prepared any visuals, but I am very eager to have a conversation with all of you. I can tell from my conversation with Kevin earlier and from listening to you guys talk that you are very intelligent consumers of knowledge about what's going on with this pandemic. And I think we're all kind of eager for opportunities to process this together. And I learn a lot whenever I speak to any group. So I'm very happy to tell you a little bit about kind of what's happening here in Massachusetts, where I live. I think you guys are all around the country. Am I correct?
Yes, we have from many different states, everybody from Arizona, Ohio, California, Tennessee. We're all around the country.
Wow. Well, I think that, we're all probably experiencing some very similar themes, but I imagine the background on which they are occurring is different. I feel like the insight that I've had has been obviously very local to Massachusetts, but my family is in Florida. So I've also had some experience. Oh, hi, Shelley. I'm from Cocoa Beach. So I've had some insight into kind of on the ground what's happening in another part of the country. So, I mean, just to give you my thumbnail of what I see going on here in Massachusetts, I'll start out by just saying, I'm an infectious disease specialist, so I take care of patients in the hospital. I also primarily do research, and my research has been in the area of vaccines for cholera and diarrheal diseases, also travel medicine, and research related to the role of international travelers in the spread of infectious diseases. And so now, of course, also COVID, because everybody really in my institution who's an academic infectious disease specialist has swung their attention to COVID in some capacity, whether you want to or not. And so, I mean, I think, I have a couple of perspectives. The other piece about me is that I'm actually a member of my town government in my community where I live. And in New England, we have town meeting, which is a very participatory democratic system where 180 of us meet and determine all of the rules and laws for our town together. And so I have a little bit of insight into how the sausage gets made on that front, and have worked very closely with my own municipal department of public health for just years in that capacity. So, going into the pandemic, I think that was the perspective that I brought to it early on. And, as an infectious disease doctor, we were all, panicked as we watched the occurrence in China and Europe and the steady march of the virus to us without really a sense of urgency or knowledge on our side about how to prepare and deal with this. I was very much upfront in my own institution to the grave problem we had with the lack of a diagnostic test for COVID in the early days, which really limited our ability to understand what was going on. And I watched firsthand, as our governor, frankly, on the day that the first COVID cases were announced in the state, which was a Friday afternoon, proceeded to have a press conference and then get on a plane to go to Utah for a ski trip. And it was hard to watch. And so I think that's kind of been the story of the pandemic for all of us, is this kind of flat-footed response. The limitations of our public health infrastructure, which have been really laid bare, I think, in the context of this. And, I think if I look to the current moment, I think there's a couple of big themes that I'm thinking about now, and many of them relate back to that. One is the emergence of the variants, which Kevin was alluding to, which I think epidemiologically and from a perspective of our health system is actually a huge threat, which I feel has not been given the attention it deserves. So that's one topic which I think is at the forefront of our minds. I think the second topic is the emergence and availability of these vaccines, which hold great promise for all of us. They really are, I think, a accomplishment of our modern biomedical research infrastructure. I know many of the people who've worked on these vaccines. I was, involved early on in lots of discussions about mRNA vaccines for other diseases that I care about. And so I appreciate that, the pipeline we had in place to develop these kinds of vaccines is an incredible thing. And it is an incredible accomplishment that we've brought these vaccines to where they are in such a rapid time. But the thing that I'm struggling with a lot around that is, the massive challenge we have in actually getting vaccinations into people's arms in association with this. And right now, the really stark inequities of our health system, our inability to access some of our most deeply affected communities, which here in Massachusetts is a lot of undocumented people. These are really big challenges to how or whether we will be able to achieve the promise of these vaccines. And, I'd love to have some conversation with you guys around that topic. A colleague and I actually here in Massachusetts just this weekend over MLK weekend organized a sign-on letter calling for our state to prioritize access to vaccination in our hotspot communities here around Boston. And it's just shocking how unprepared we are to roll vaccine out to the places where it is most desperately needed. And so there's a lot to unpack there with our health system. And then the other theme that I think has just been present for me is, and I've learned a lot on this from Chris, is the issue of just workplace safety and how important that is in this pandemic. I think here in Massachusetts, we really have not done much to make the workplace safe. I think it's been unfortunate that there's been a heavy emphasis on personal responsibility in terms of controlling the spread. Mask wearing and physical distancing. I think that unfortunately in the hierarchy of controls in occupational health, they are not particularly effective, and they are really not the ones you want to be relying on. But unfortunately, we just haven't been able to muster the ability to make workplaces safe. And so consequently, I do think that's a really key thing. Our essential workers are bringing it home to their houses. And we know here in Massachusetts that communities where people live in densely populated settings are where we've seen the most virus transmission. And we just haven't controlled virus transmission in those settings. Even when we had our spring surge, we went down to a low burn, and we didn't really, we weren't able to muster a response sufficient to really get transmission under control. And so we all knew it was coming, that, you know, when the colder season hit, that the virus was going to ramp up again. And so this all has seemed so horribly predictable, and yet so difficult to prevent. So I think that, you know, that's been a real struggle, is all of that. And so, you know, I think a big thing I'm just thinking about now is just the structural elements that are crippling us in our ability to control this. And my hope that with the new administration, maybe we will pivot to address some of those fundamental issues, but we're really behind the 8 ball because we have such high levels of transmission right now that it's a hard time. It's a hard time for doctors and nurses and all of us in the hospital. You know, we are stretched. We are just stretched beyond breaking points. Our community health centers here in Massachusetts, you know, they're shouldering an incredible burden of testing, which they can barely keep up with. And now the notion that somehow these same institutions are going to be able to mount a vaccine rollout, you know, it's hard to imagine. You know, we almost need to call up another core of people. That, you know, I've heard discussion of, you know, are we going to activate the public health core from the CDC? Like, we just need to bring in a public health army, and we haven't done it. I mean, some colleagues and I wrote a piece in the Boston Herald, actually, in early April. Got a lot of attention. You know, we need a public health army. I think we just don't have that army. And, you know, we need an army that's going to help us do better surveillance. We need an army that's going to help us roll out vaccines. We need an army that's going to feed people and house them and provide for some very basic needs, which are not being met in certain communities in the setting of the, you know, what's going on. So, you know, I'm hoping that we are going to apply the resources and the manpower to this problem, that it is justified. But we're doing it at a time when the virus has the upper hand. And that's worrisome to me. So anyway, that's a thumbnail of where we are in Massachusetts. We've had inequity, we've had flat-footed public health response, we've had a heavy emphasis on personal responsibility. We've had a very top-down management style, which has, frankly, I think, pushed up against the limits of how effective that can be in the public health sphere. You know, we've had people who have access to things, having access to things, and people who don't have access. And that's been really the story. And I think that that's probably similar in other places too. But I'd be very curious to hear, you know, perspectives from you guys and have some conversation. So that's my thumbnail.
Well, thank you very much. I do appreciate your time. Any comments or questions?
I have a question about from the public, you know, have some doubt about the vaccine safety. And, you know, that's also critical, how to earn the public trust, you know, to get mass vaccine. And so what is your opinion or suggestion that you think that we could help to gain the public trust so that more people will be vaccinated to fight the pandemic?
Well, I mean, I think it's such an important question, Yan-Ling. And you know, there's the issue is there's not an easy solution to this problem. So, you know, the way I conceptualize this issue is that, well, we have failed in our pandemic response, right? We have really not cared for many communities who have been really affected by this. They have earned distrust in our medical system because of what has happened, right? So we are starting behind the 8 ball now, trying to argue to those groups that, suddenly now we're here to help you by giving you this shot, when frankly, for months, we really haven't been there to help these communities. So that's just a fundamental problem. And that is not anything that we can surmount except by continued engagement, by changing how we are caring for these communities, by taking a wraparound approach to people's real human needs right now. So, I mean, there's just that kind of simple overarching fact, I think, which is one thing, and then on top of it, we have another kind of separate issue, which is this long slide in our society towards distrust of vaccines and kind of science in general. And, I feel like that comes from a different place and probably requires a different type of response. And I suspect that, it's important to really understand in any given community which of these elements are driving people's hesitation about the vaccine, because it seems to me that they need to be approached in a different way. I feel like both of those issues, the kind of anti-science, anti-vaccine, and the distrust of the healthcare system, have been amplified with how things have transpired. We certainly all have watched as many people have been put forward to be experts on things when I think often they weren't. I think that when there's a vacuum, somebody steps in to fill that. And because the CDC was not able to be at the forefront of messaging after February or so, that lots of other forces stepped in to provide information to people, understandably, scientists, many of them, but not public health practitioners. And frankly, that kind of debate that is part of the scientific process, where people want to talk about models, if this or that, or maybe you're wrong, or, we need to understand more. That's part of the scientific conversation. But when you're trying to message a kind of basic public health messages to a broad community, and people are hearing a lot of that, I feel like that played into the problem. People, you talked about aerosol transmission. We allowed ourselves to the debate about aerosol transmission and the role that it played in this virus. It was overlain with some political stuff, because the implications of aerosol transmission are very different in terms of your policy response and the amount of money you have to spend. And so I think people allowed us to go down this rabbit hole of let's debate the science, and let's ignore what the science really tells us we have to do. And so there was just some, I think, very unhelpful public dialogue that has transpired. And I feel like scientists were part of that problem in a way. I don't know if I want to call it a problem, but that dynamic. It's the same as climate change, which has been the area that I've worked on, in my kind of advocacy sphere. It's much easier to debate the science and the details of the science than it is to actually apply yourself to figuring out how to solve the problem, which the science tells you need to solve. And so we fell into that trap. And I mean, it's going to be the same with how people respond to this vaccine, because we haven't had a laser-like focus on how to communicate with people around this and how to build trust. And so my feeling is that people who, it seems like we need a bottom-up response on this, and people who are physicians, nurses, health professionals, scientists in our own community. I feel like I give talks like this all the time now. I'm just willing to talk to anybody who will listen. And I think that we just need to be doing more talking from people who hopefully are trusted sources of information. And we have to be a little more humble about what we know and what we don't know, because that's okay. You know, like that's where I talk about this top-down approach, but we've had so much of this, you know, like everybody just listen up and this is what you're going to do. You know, we have to be able to acknowledge that, you know, with this vaccine, you only had to have 2 months of safety data in order to get the emergency use. So we only really know if it's safe for 2 months. But I'm going to tell you, as an infectious disease doctor, 2 months seems like a reasonable amount of time for a, you know, real concerning adverse event to pop up, right? So you just have to, I think we all need to lean in a little bit if we are in this health sphere and engage with people, and try to push our health system more in the direction of earning people's trust.